Hi, I'm Stacey Elliott. I'm a physician, part of the sexual rehab service in Vancouver, BC. And I have a special interest in persons with spinal cord injury and their sexual rehabilitation and fertility aspects. We're very fortunate in Vancouver to have a multidisciplinary team of nurses and OTs and PTs and physicians, etc., that help people learn about their body, learn about their sexuality, and what their fertility potential is after their spinal cord injury. We base our sexual rehabilitation program on 3 principles, and the principles are that you maximize your own physiology before you add in any drugs or any adaptive aids. And that's because we really believe that sex is a mind-body component, and that you want to, with whatever function you have and you still have your brain, you want to incorporate that to maximize your own sexual experience just with what you have. The second rehabilitation principle is to adapt or utilize aids or medicines to increase that potential that you naturally have physiologically. And the third rehabilitation principle is to stay open in your attitude and be non-judgmental about yourself and try to push your envelope a little bit and experiment with new things. We find that the people that do the best in their sexual rehabilitation are those people that are willing to try something different that they may not have experimented with prior to their injury. After spinal cord injury, women should maintain their fertility. They may lose their period for 6-9 months, but once they get that back, they should be as fertile as they were prior to their injury. Men, however, have problems with their fertility after spinal cord injury, and it's because of a few factors. One is they might have difficulties with erection. The most prominent factor is they have difficulty with ejaculation. And the third is that their semen quality may deteriorate after their spinal cord injury. So at the Vancouver Sperm Retrieval Clinic, we specifically focus on how to obtain sperm, and we can use that sperm or that semen to try to impregnate somebody. So most of our clients here are spinal cord injury, and they have trouble actually getting the sperm out or ejaculating. So there's 2 main methods that we use to try to obtain sperm. If you have a higher level injury, usually above T10, we try to use a very strong vibrator, which I'll show you in a minute. If that fails, then we use another technique, which is basically jump-starting the nerves with an electrical current called Electro Ejaculation. After spinal cord injury, men are very curious to see whether or not they can ejaculate. And we do recommend that if they're having trouble in a sexual situation, that they may try a vibrator, but a very low frequency, so that it doesn't necessarily provoke autonomic dysreflexia. In our clinic, we have vibrators that are relatively strong, and this would go around the penile tissues. For example, it would usually go around the frenulum, and what will happen is that even if there is no erection, there'll be quite a bit of spasm provoked, and hopefully ejaculation will occur. In our clinic, we have various vibrators. Some are less strong than others. If you compare the intensity, the amplitude, and the frequency of this vibrator compared to a vibrator like this, it's quite a bit stronger. And then we have commercial vibrators. And these are all able to be used to try to produce ejaculation, but I caution people to be careful with this, and that the first time they try it, to maybe come into a clinic and monitor your blood pressure to be sure you're not getting dysreflexic. This is the probe for electroejaculation, and this would be inserted into the anus and the current turned on. If you have any sensation, you would be given anesthesia for this. Otherwise, if your injury is complete, you may be able to do this as an outpatient.
Hi, my name is Koloski. I am a sexual health clinician who works at the Vancouver Sperm Retrieval Clinic, as well as the Sexual Health Rehabilitation Service at GF Strong and the Blasson Spinal Cord Center. My role is sort of multifaceted. I work with couples in the fertility clinic, as well as couples who are starting their sexual health rehabilitation journey. So clients often come to our office for a few different reasons. The main questions that are asked to us are usually, am I going to be able to find a partner? Am I going to be able to be a parent? Or am I even going to be able to have sex again? So within our service, we do often address these typical questions with clients, but really taking into consideration the client's full experience, as well as their level of readiness and adapting to their own personal situation. So we like to look at the whole person when we see them in the sexual health department. So addressing your sexual health concerns with your care provider, your partner, I think is really important, because what we see, or what I see as a clinician, is that when people don't talk about their concerns because they're fearful of, what the outcomes might be, it actually has a bigger effect on the person inside, and it comes to confidence and sexual self-esteem. I think it's really difficult to define, how you become successful in the sexual realm. When we look at our outcomes for clients, I think the biggest success that we have is being able to talk to clients openly about their concerns in a way that's comfortable for them, allowing their concerns to be normalized and validated, and so they feel like they're not alone. And to me, I think that's a pretty big success.
The Sexual Health Rehab Service was established in 1975 by Dr. George Saz at the acute spinal cord injury unit at Vancouver General Hospital. Part of our service is with spinal cord injury, but we also see people with other disabilities and chronic illness. All sexual beings, and sexuality is part of everybody, no matter what their age, gender expression, gender identity, socioeconomic status, ethnicity, what have you. When we talk about sexuality, we're not just talking about the physical aspects, we're also talking about the emotional, psychological, and social parts to our sexual being as well. With our team of specially trained rehabilitation nurses and other sexual medicine physicians and other allied health colleagues, we work with people to help them manage the changes to sexuality that they've experienced as a result of injury. In order to promote best practice development in the area of sexuality and disability, the Sexual Health Rehab Service is involved in a number of research practice initiatives. One project we've been working on, and it was funded by the Rick Hansen Institute, is the SCI-U project, which is an online education tool for persons with spinal cord injury and their loved ones to learn about sex and disability. One of the reasons our program has been successful and lasted this many years is the collaborative relationships that we've built. And for example, with BCPA peer program, with the BC Centre for Sexual Medicine. One reason I'm happy to be part of this video is we need to dispel some of the myths out there in society about sex and disability and sex and spinal cord injury, because as long as those myths exist, people start to believe them, and they won't seek the help that they need. So don't be afraid to ask those questions, and don't be afraid to explore your body, and just have fun.